Hi everyone, welcome. I'm so glad you're here. My name is Helen, my pronouns are she, her, and I'm recording this from Massachusetts, where I currently serve as the Senior Special Programs Coordinator for Women, Gender, and Sexuality at Bristol Community College. I spent all of last year going into Chicago public high schools doing my consent workshop, and I also teach comprehensive sex ed to 4th through 6th graders. So I love doing this work with folks of all ages, and today's presentation is about sexual health, focusing on contraceptives and STIs. This is a space where we can have real, honest conversations about sexual health. No judgment, no shame, no awkwardness required, although it's fine if you want to laugh through some of the awkwardness because we're all humans and we're going to be talking about bodies and things that might make us giggle, and that is completely fine. But most importantly, we're going to talk about topics that everyone deserves clear information on: STIs, contraception, and how to make choices that keep you healthy, confident, and in control of your body. You don't need to know anything before arriving here. Just bring your curiosity. This is your time to learn about things you may have always wondered about and get answers based on facts, not rumors. By the end, my goal is to have you leave feeling empowered and informed about how to protect yourself and your future partners. Sexuality is something that we all have. It's not a bad or dirty word. It is the core of our humanity. None of us would be here without it. It is an essential, lifelong, so from birth to death aspect of being human. It's something we're born with, like our skin. It's not something we get at a certain age. A healthy culture celebrates sexuality with respect, openness, and mutuality. And these things are necessary so that folks can ask questions, get answers, and protect their health, make healthy choices, and seek help when they need it. So this is a shame-free zone. This is a judgment-free zone, and I always prioritize consent. So while you're here listening, you don't have to participate. You don't have to do anything that you don't want to do. Consent. Consent is always freely given, and all people in a sexual situation must feel that they are able to say yes, no, or stop the sexual activity at any point. So, in summary, everyone's glad to be there and free to leave without any unwanted consequences. No threat of physical consequences. Obviously, physical violence is never okay, but even the threat of social or emotional consequences is not okay. That can be like someone will be mad at you if you don't want to participate or you want to stop. Someone won't want to be your friend anymore or won't want to be in a relationship with you if you don't want to do said act or if you want to stop at any point. So those types of emotional and social threats, those aren't okay either. And if they are present, then true consent is not present. True consent is present when no one will judge you for stopping, because what matters most is that everyone has a good time. This acronym is helpful. FRIES: F, freely given; R, reversible, you are allowed to change your mind; informed, you need all the information in order to be able to consent to something; enthusiastic, so that means you get a clear yes for no other reason than the person genuinely wants to; and specific, so consent to one act does not equal consent to another act. It has to be specific, it has to be clear. Both parties have to have all of the information. What is the difference between STIs and STDs? So STI stands for sexually transmitted infection, and STD stands for sexually transmitted disease. The key difference is that infection means the presence of a virus, bacteria, or parasite in the body with or without symptoms, and disease means the infection has started to cause noticeable symptoms or health problems. Why STI is preferred? So STI is more accurate. Not everyone with an STI has symptoms, but they can still spread the infection. STI is also less stigmatizing. The term disease can sound scarier or more shameful than infection, which helps reduce stigma and encourages people to get tested. Stigma refers to a negative label or judgment placed on someone because of a characteristic, condition, or behavior, often leading to shame, discrimination, or social exclusion. In the context of sexual health, people with STIs, mental health challenges, or certain sexual behaviors might face stigma, even though anyone can get an STI or be in a situation where they need help. Just like anyone can get COVID, the flu, or any contagious infection, anyone can get an STI, and it's not a sign of someone's worth whether or not they've had an STI. Stigma can make people afraid to ask questions, get tested, or seek treatment, which can be harmful to their health. So the most important thing is having the information to keep yourself safe. And if something does happen, where even if you're doing everything as safely as possible, something still can go wrong, the most important thing is that you're able to seek help, and you shouldn't feel any shame around doing so. Stigma is about what other people think or say, not about who you really are. And talking openly, educating ourselves, and showing respect helps break the stigma. What are STIs? Sexually transmitted infections are infections passed from one person to another through sexual contact. That means vaginal, anal, or oral. They're caused by bacteria, viruses, or parasites. Bacterial and parasitic infections can usually be cured with antibiotics or medication. Viral infections usually can't be cured in the same way because viruses live inside of your body's cells. However, that doesn't always mean that they're permanent or dangerous. Some viral infections, like HPV, often go away on their own as your immune system clears the virus. Others, like herpes or HIV, can't be cured yet, but they can be managed with medication so people can live healthy, full lives and reduce the risk of passing them on to others. Some viral infections, like the flu or COVID, typically are cleared within your body over time and can be prevented with vaccines. Here are some common STIs. Chlamydia and gonorrhea are both bacterial, so they can be treated with antibiotics, and for both of them, there's often no symptoms. However, there can be symptoms in some cases, things like unusual discharge or pain, but many times there are no symptoms. So that's one of the many reasons it's so important to get tested regularly. HPV, human papillomavirus, this is viral. So other examples of viral infections are, the flu, COVID, also things that can be prevented by vaccines. And there is an HPV vaccine, which we'll go into. HPV is the most common STI. So reports show that most sexually active individuals will come into contact with HPV at some point in their life. Some strains of this may cause warts or lead to cancer. Viral infections in general can't be cured in the same way that bacterial infections can be cured with antibiotics because viruses live inside of your body's cells. However, that doesn't always mean that they're permanent or dangerous. Some viral infections, like HPV, often go away on their own as your immune system clears the virus. However, others, like herpes or HIV, can't be cured yet, but they can be managed with medication so that people can live healthy, full lives and reduce the risk of passing them on to others. Other viruses, like the flu or COVID, are viral infections that your body typically clears over time. And For many of these viruses, you can prevent them through vaccines. Trichomoniasis, also called trich for short, is parasitic. It causes itching and discharge, but also there are cases where there may be no symptoms and it is curable with medication. Herpes. There are two strands, HSV1 and HSV2. These are viral and there are no cures for herpes yet. However, it is very manageable through medication. It causes sores or blisters on the mouth or the genital area. Syphilis. Syphilis is bacterial, so it can be cured with antibiotics. It progresses in stages and it can cause various serious complications if untreated. Pubic lice is tiny insects that live in coarse body hair like pubic hair. It's spread through skin to skin contact or by sharing things like bedding or towels. It causes itching with small blue or red spots, and sometimes you can see the lice or the eggs. It's curable with over-the-counter or prescription lice treatments like special shampoos or creams. HIV. HIV is viral, meaning it lives in your cells. It attacks the immune system and can have very serious implications if it's not addressed. However, it is treatable with a medication called ART, and people living with HIV today can have very healthy, normal, and fulfilling lives. One question I get a lot is, what is the difference between HIV and AIDS? Or is there a difference, or can these terms be used interchangeably? So let me explain the difference, because there's a big one. Over time, if HIV isn't treated, it can weaken the immune system so much that the body has a hard time fighting infections and certain cancers. AIDS is the advanced stage of HIV not being treated. AIDS stands for Acquired Immunodeficiency Syndrome. It's the most advanced stage of HIV when the immune system has been very badly damaged. A person is diagnosed with AIDS when their CD4 cell count drops very low, or they develop certain serious illnesses that their body can't fight off. So in some ways, it's similar to that distinction between an STI and an STD. We can get infected with something initially, but if it's not treated, it can lead to something much more serious. When to seek medical attention? When you notice unusual discharge, burning when peeing, sores, bumps, or rashes on or near the genitals, pain during sex, itching or irritation, and some STIs have no symptoms at all, which is why testing is very crucial. Preventing STIs. Use condoms every time. They reduce risk but don't eliminate it. Get tested regularly, especially if you're sexually active with multiple partners. Talk openly with partners about STI status, testing, and protection. Avoid sharing toys unless properly cleaned or covered. Vaccines are available for HPV and hepatitis B, so make sure you ask your doctor. Get tested and seek treatment as soon as you know you need it. Many STIs are easily treatable with antibiotics or antiviral medications. Health centers usually offer confidential, low cost, or free testing. So get on Google and search free STI test near me. You should definitely find something. Some states offer programs where even tests by mail can be obtained for free. The earlier you get tested, the better for your health and for your partners. What vaccines are available? HPV for human papillomavirus, and as we know, this is the most common STI, so this is a really important vaccine, and this is a newer vaccine. So I was in the first generation of girls who got it when I was around 9 years old. and I'm so grateful that I did. Gardasil 9 is the name of the shot. Ideally, you get it before becoming sexually active, like ages 11 or 12, but you can get it up until age 26. The hepatitis B vaccine, HBV, which affects the liver and can be spread through sex, needles, or birth. It's usually given in childhood, but catch-up vaccines are available for anyone who missed it. Hepatitis A, HAV, spreads through contaminated food, water, or sexual contact. And Hep A and Hep B vaccines are typically given to young children. So most of you probably already have these, but it's worth checking. No vaccines exist yet for HIV, herpes, syphilis, chlamydia, or gonorrhea. Getting vaccinated doesn't mean you can't get other STIs, so using protection and getting tested is still important. So just because you have the vaccine, it doesn't mean that you can't get it, but what it does mean is that you'll be less likely to get it, and if you do get it, it'll be less able to fully attack your immune system. So you'll already have some immunity built up, and that means that either the cure or the medication will work better on you because it will have less of an infection to fight against. PrEP is the closest thing we have to an HIV vaccine. So PrEP is a once daily pill or injection every 2 months that prevents HIV. When taken as prescribed, it can reduce the risk of getting HIV from sex by about 99%. So that is huge. It's really protective. You should consider PrEP if you have multiple sexual partners, don't always use condoms, having a partner living with HIV, are unsure of your partner's HIV or STI status, or if you inject drugs or share needles. How to get PrEP. Talk to your healthcare provider. You'll need an HIV test. You must be negative to start PrEP, a kidney function test, and regular follow-ups, usually every 3 months. Most insurance plans, including Medicaid, cover PrEP. Many programs offer it free or low cost. So how do STI tests actually work? There are a lot of different ways you can get tested. One is a blood test. This is used for HIV, syphilis, herpes, Hep B and C, and some other infections. Urine tests are used for chlamydia and gonorrhea. Swab tests are used for gonorrhea, chlamydia, trich, and herpes. Physical examination is used for diagnosis of visible STIs like herpes, warts, syphilis, which can cause sores or rashes, and sometimes pubic lice. Rapid testing is available for HIV and sometimes syphilis.
The answer to this is a big fat false, and let me tell you why. My name is Dr. Kameelah Phillips, board-certified obstetrician and gynecologist, and I'm here today to talk to you about STIs. So what is the difference between an STD and an STI? An STI stands for sexually transmitted infection. STD stands for sexually transmitted disease. We actually don't use that word anymore. Disease is really stigmatizing, and infections are easily treated. You also can have symptoms of an infection before you actually have a disease. So what we use now is sexually transmitted infection. How common are STIs? STIs are actually super common. In fact, 1 in every 2 people will have a STI by the age of 25. Gonorrhea and chlamydia are the most common STIs. With the 1.8 million cases of chlamydia reported, 2/3 of those are in ages 15 to 24. How do you know if you have an STI? Most STIs don't have symptoms. That's why it's really important for you to see your healthcare provider and get tested and treated. Most treatment involves antibiotics, which are widely available and will take care of the infection for you. Is an STI screening painful? Lucky for all of us, STI screening is not painful at all. It can involve a soft cotton swab or peeing in a cup. It's fairly easy. How often should you be tested for STIs and when should you start? The CDC recommends that all people under the age of 25 get tested annually or with each new partner. Women over 25 should be tested with each new partner. You can't get an STI from oral sex. The answer to that is false. STIs can be transmitted through oral, vaginal, and anal sex, and even with genital-to-genital contact. So that's why it's important that you have regular testing. If left untreated, STIs like gonorrhea and chlamydia can cause fertility issues in women. The answer to this is true. Untreated STIs like gonorrhea and chlamydia can lead to pelvic inflammatory disease, and this can cause infertility. This is why it's so important to be tested regularly and treated to prevent this unfortunate outcome. Your doctor will only screen you for STIs if you're sexually active. The answer to this is false. When you come in for an annual visit, you may be screened for sexually transmitted infections regardless of your sexual history. Regular testing, regardless of age or sexual behavior, helps us keep an eye on your reproductive health. So regular screening helps us help you maintain good reproductive health. You can only get an STI if you've had multiple sexual partners. The answer to this is a big fat false, and let me tell you why. It doesn't matter. STIs don't discriminate, so whether you've had one sexual partner or 10, you can still get an STI. That is why regular screening is very important. Once you have an STI, you're immune to it. The answer to that is false. Just because you've gotten an STI once doesn't mean you can't get it again. In fact, having an STI can also make you more susceptible to other STIs. Most STIs will clear up on their own. False. Most STIs, like gonorrhea and chlamydia, need to be treated with antibiotics. They will not clear up on their own. So just remember, it doesn't matter who you are, how you love, or who you have sex with. It's just important to get tested. For more information about being tested, please visit screenings4her.com.
Now we're going to discuss the various forms of contraception. Fertility awareness is really important to understand your body, your partner's body, communicating with your doctor to get the best care for you. So track your ovulation, use a period tracker app, always check the privacy policies. Some free apps may share data with third parties. Clue and Spot On are known for being especially privacy conscious. There's also Flow, My Calendar, and you can also do it the old-fashioned way on a piece of paper. So you could Google, period tracker, and it'll show you a little calendar that you can fill out manually. There are hormonal methods. So these use hormones to prevent ovulation or make it harder for sperm to reach the egg. One example is the pill taken daily. It's a combination of estrogen and progestin or progestin only. And I know where I live in Massachusetts, the O pill, which is progestin only, is now available over the counter, and Massachusetts residents can actually get up to a year's supply of this for free without a prescription. So doctors have deemed it safe enough that you don't necessarily need a prescription. However, because everybody is different and everyone's hormones are different, you will probably get the best birth control for you if you are able to go talk to a doctor, explain some of the symptoms you get around menstruation, and that way they can determine the best one for you. However, the progestin only pill is really considered the best one size fits all, although that is a little bit of an oversimplification. There is also the patch. It's worn on the skin and replaced weekly, like shown in this image. There's a vaginal ring that is inserted monthly. There is a shot that you can get every 3 months. There is an implant that is a tiny rod placed under the skin that lasts up to 3 to 5 years. However, I have heard a lot of criticisms of the rod. Doctors tend to find it kind of challenging to get in and out. So sometimes there have been, uncomfortable mishaps with that. There is a hormonal IUD. It's a T-shaped device that sits in the uterus that lasts 3 to 8 years. So if you just want something that you don't have to worry about for many years, an IUD is a great option. There are also non-hormonal IUDs, which we'll cover in a second. Depending on where you live, you may be able to access free birth control. So I recommend getting on Google and doing a search, free birth control options for insert my state. In my state of Massachusetts, there is a new law called Access that covers a year's supply of the pill, patches, rings, or injectable birth controls. Sometimes you can even get free condoms if you have a prescription for them for your doctor. So take advantage of what your state has to offer. Non-hormonal methods. So these birth control methods don't affect your hormones, and some are only used during sex. So there is a hormonal IUD, which we just mentioned, but there's also a copper IUD. So it's non-hormonal and it prevents sperm from fertilizing the egg, and it lasts up to 10 to 12 years. Copper is very safe for our bodies, but it makes the uterus an uncomfortable place for sperm to live. So what is the difference between a copper IUD and a hormonal IUD? The copper IUD lasts up to 10 to 12 years, whereas the hormonal IUDs can last between 3 to 8 years. The Mirena one lasts 8 years, Kameelah 5 years, Liletta or Skyla 3 to 6 years. And you can also always get these removed sooner. The differences on the impact of your period: with a copper IUD, periods may become heavier, especially at first. With a hormonal IUD, periods become lighter. So this is good for people with painful or heavy periods, because birth control is not just used to prevent pregnancy, it can also be used to manage uncomfortable periods. So the best way to know which birth control is best for you is to track your period and track the symptoms you have to go along with it. That way you can communicate accurately with your doctor, and they'll be able to understand which option might give you the results that you're looking for. Condoms are another non-hormonal method. So there are internal condoms for a vagina and external condoms for a penis. An internal condom is a soft, pouch-like barrier worn inside the vagina or the anus during sex. An internal condom comes with 2 rings. The inner ring goes inside of the vagina to hold it in place, and the outer ring stays outside, covering part of the vulva. Internal condoms are 95% effective with perfect use, but in reality, 79% effective, and they are not as commonly used as external condoms because of this. Typically, when you hear the word condom, what comes to mind is the external condom used on the penis. They are 98% effective with perfect use, but in reality, closer to 85% effective. And condoms are typically made out of latex, so it's really important to know if you have a latex allergy. You certainly don't want to be finding that out for the first time when you're putting latex on your genitals. It does happen, and people have to go to the hospital, and that, of course, would be very traumatic. But please know that if you do have a latex allergy, there are lambskin or other animal membrane condoms. However, lambskin condoms are only good for pregnancy prevention. They don't protect from STIs. The reason why is that lambskin condoms have tiny natural pores in the material, These pores are too small for sperm to pass through, but large enough for viruses and bacteria like HIV, chlamydia, gonorrhea, or HPV to pass through. So many people don't know this, but lambskin condoms only protect from pregnancy and they don't protect from STIs. A dental dam is a thin, flexible sheet, usually made of latex, but they also have non-latex ones, used as a barrier during oral sex to help prevent the transmission of STIs. It's typically placed over the vulva or anus to reduce direct mouth to skin contact. So similar to a condom, but it covers the vulva or the anus. Another non-hormonal method is the diaphragm or cervical cap. This is inserted before sex to cover the cervix. This works as a barrier method. By covering the cervix, it prevents sperm from entering the uterus. So you put it up there with your finger. In order to make this barrier method effective, it's highly recommended that you also use spermicide or vaginal gel. And this is a gel or cream or sometimes a little suppository that you insert deeply into your vagina near the cervix before having sex. Sometimes it comes with an applicator similar to a tampon, so you get it deep in there and then give it like 10 minutes to dissolve before having sex. And this is gel that kills sperm. Now, you never want to use spermicide as your only form of birth control because it's not reliable enough for that. But using it in addition to one of these other methods mentioned, diaphragm, cervical cap, condom, it is really great for that extra caution.
Hey guys, it's Nicole here, Amaze's peer ambassador. And, whew, OMG, my phone is blowing up. Okay, my little sister's friends are texting me all these questions about birth control. And to be honest, some of them are actually scared of using it because of what they're seeing online. So I'm here today to finally clear the air on what's actually true and what's not about daily birth control pills using a bunch of trusted resources. That way, people can make their own informed and scientifically backed opinions on whether or not to take it for themselves. Let's get into it, guys. So my sister's friend Jess asked me if birth control gets in the way of having kids if you wanted them later in life. And that answer is no. So, Bedsider is this great nonprofit organization with tons of medically backed resources surrounding birth control. And according to this article, they highlight research that says birth control can prevent pregnancy while you're using it, but it does not have lasting effects when you're not. I mean, think about it. That's why people who forget to take their birth control can still get pregnant. The article gives specific stats on what percentage of people who were trying to get pregnant succeeded after they quit taking birth control pills. And on average, 21% were pregnant after just 1 month, and 79% were pregnant after 1 year. If you feel like you need a little more stats to ease your mind, this other research study posted by the National Library of Medicine said the same thing. Contraceptive use, regardless of its duration and type, does not have a negative effect on the ability of women to conceive following termination of use, and it doesn't significantly delay fertility. So, let's consider this myth debunked. Okay, then Sydney asked me if birth control causes weight gain, and that answer is false. The American College of Obstetricians and Gynecologists, aka the doctors who specialize in reproductive health, concluded that there's no direct correlation between birth control and gaining weight. The main gray area here is that birth control affects your hormones, and your hormones can affect your body in similar ways that your menstrual cycle does. So, just like how at some phases of a menstrual cycle, your body can feel bloated or different, the same can apply if you're on birth control. Weight fluctuation is totally normal for everyone's bodies and is a part of your body's regulation process, regardless of birth control. The main thing to note is that doctors found no evidence that birth control causes weight gain directly. Katie's worried that she won't be attracted to her boyfriend anymore if she starts taking birth control. And that is false. In a large scientific study conducted in 2018, researchers found that women's preferences for men's faces are reliably stable, regardless of whether they're taking birth control pills or whether they're ovulating. According to the study, they surveyed over 500 heterosexual women, and results show no evidence that women's preferences for their male partners were related to changes in the women's contraceptive use. A lot of my sister's friends have been worried about this particular myth because they've been seeing a lot about it online. But just because it's out there doesn't make it true. I mean, if you really have hesitations on what you're reading online, it's always worth it to double check with your doctor to make sure you're getting the right info. Well, friends, I hope this made you feel a little better about birth control. With some help from my trusty articles, we've debunked that birth control does not affect your ability to have kids. It does not directly make you gain weight, and it does not negatively change how you feel about your partner's looks. And listen, I know there's a lot of different information and opinions about birth control online, but that's why it's super important to keep in mind not only what's being said, but who's saying it. Do you think they're trustworthy? What kind of other topics are they covering? And do you think they actually know what they're talking about? Usually, it's best to check more than one source too. The more evidence, the better. And when all else fails, you might as well just ask a doctor. I'll be including all the links to the articles I mentioned in the video description if you want to check them out. And remember, the choice to take birth control is completely yours alone. But make sure you're doing what's best for you, not what some viral thing online said, okay? With that said, I'll see you next time. Bye, guys!
Emergency contraceptives are used after unprotected sex or birth control failure, like a condom breaking. The medication names themselves are a little hard to pronounce, but levonorgestrel, also called Plan B or My Choice, is most effective within 72 hours. However, this one does not work for people over a certain weight. So if your body mass index is over 25, then the better option for you is the medication called ulipristal acetate. The brand name is Ella, and you usually need to get this by prescription. And it also works up to 5 days after the birth control failure. So if you miss the 72 hours, you can get a prescription for Ella. And a copper IUD can actually be used as emergency contraception if it's inserted up to 5 days later. Up to 5 days after unprotected sex, if you're getting a copper IUD, that can serve as emergency contraception. However, this is not reliable because usually, if you need an appointment for an IUD, you're not going to be able to get that appointment in 5 days in most cases. Mifepristone is the abortion pill. So this is taken at a clinic or at home, depending on local regulations. This pill blocks the hormone progesterone, which is essential for maintaining a pregnancy. Without it, the lining of the uterus breaks down, stopping the pregnancy from progressing. So it basically forces you to get your period. It forces the uterine lining to shed, and therefore nothing can stay in the uterus and you will not maintain a pregnancy. It is effective up to 10 weeks of pregnancy, and it is about 95 to 98% effective. It becomes slightly less effective as pregnancy progresses. Common side effects: cramping, bleeding, often heavier than a period, can cause nausea, vomiting, or diarrhea, headache, fever, or chills. All of these are usually temporary. Safety: it's very safe. It's medically approved and very safe method when used correctly. Complications are rare, but they can include heavy bleeding, infection, or an incomplete abortion, which may require follow-up care.
Hi folks, my name is Sam, and I'm your friendly guide through some pretty big and complicated topics. Today, I'm here to help us explore the topic of abortion. There's a lot to say about abortion, so I'm going to do my best to talk us through some of the most important facts to help make it clear and easy to understand. First off, Abortion is a very personal decision, and only the person who's pregnant can know what is best for them. For anyone dealing with an unintended pregnancy, talking with a trusted adult can help to figure it all out. And I'm here to help too. So, let's start with some of the basics. When a person gets pregnant, they have 3 options. They can carry the pregnancy to term and raise the baby. They can carry the pregnancy to term and place the baby for adoption. Or they can end the pregnancy by having an abortion. You see, there are a lot of reasons a person might have for making any one of these decisions. If someone decides to get an abortion, it might be because they don't want to have a baby, or maybe they can't afford to raise a child. Maybe they're in school and they're worried they won't graduate if they have a baby. Sometimes people already have children and they don't want any more. And sometimes there might be something wrong with the fetus. Either it's not developing properly or it has a serious, incurable disease. Whatever the reason, it's up to the person who's pregnant to decide what's best for them. An abortion is a very safe medical procedure. There are 2 types, medication and surgical. A surgical abortion is a short 10 to 15 minute procedure that takes place at a clinic or hospital and is performed by a healthcare provider using local anesthesia. The vast majority of surgical abortions are done during the first few months of pregnancy. During this simple procedure, a healthcare provider uses gentle suction to remove the fetus from the uterus through the vagina. Most people say the procedure feels like strong menstrual cramps, and contrary to its name, no surgery is actually involved. A medication abortion is a procedure that uses pills prescribed by a healthcare provider to end a pregnancy. It can be started either in a medical office or at home. This approach is most effective during the first 3 months of pregnancy. Medication abortion consists of 2 medications that first stop the pregnancy from growing and then cause cramping and bleeding to empty the uterus through the vagina. Most people say medication abortion feels like a really heavy, crampy period. Okay, so those are the basic facts about the physical side of abortion. Now let's talk about the legal side and what you need to understand. There are many laws pertaining to abortion, and every state's laws are different. In some states, young people need their parents' permission to get an abortion. In most of these states, young people may instead seek a judicial bypass. This is when a young person goes in front of a judge to prove they're mature enough to make a decision about their unwanted pregnancy without permission from a parent. Some states allow young people to decide on their own if an abortion is right for them, with no parental involvement. Research your state's laws to better understand your rights. Abortion can be controversial, and it's something the United States has been debating for a long time. In fact, some people feel so strongly about people not having abortions that there are places called crisis pregnancy centers. There are fake clinics that exist only to try to talk a person out of having an abortion. They look and sound like real abortion clinics, so make sure you ask if they provide the services you need and want before you go to one of these fake clinics by mistake. So, while some people don't believe in abortion, others believe a pregnant person should be able to have an abortion and not be judged by others. After all, every person should be able to decide what's best for themselves, their family, and their future. I know we've covered a lot of information. Remember, if you feel confused or overwhelmed, talk to a trusted adult. And if you need to come back and watch this video again, I'll be here waiting to help explain it from the beginning.
Thank you so much for coming to this presentation. It's so important to have the information that we need to keep ourselves safe. For any further questions on these topics, check out this list of resources. Thanks for being here today.